Okay, in this series of videos, I'm going to be explaining how to improve latch by improving positioning in several breastfeeding positions. So there are a lot of common elements to a good latch in any position. And as far as just the latch, the attachment of the baby's mouth to the breast, there are some important things to know before we begin with positioning. So if this is mother's breast, the two most important things about a good latch are that the nipple needs to be way at the back, if this is the baby's mouth, way at the back and at the roof of the baby's mouth. Now the other important thing is that the baby's tongue needs to be coming out past their bottom gums and cupping the breast. If both of those things are not true, the latch will generally not be comfortable or effective. So we're looking for the nipple at the roof of the baby's mouth and quite far back, and the baby's tongue cupping the breast and massaging it. Okay? So the first position that I'm going to show you today, I consider to be kind of the fundamental breastfeeding position. You'll often hear it called laid back positioning or biological nurturing. And it's often the first position that mothers breastfeed in. And so I'm just going to kind of demonstrate it for you and talk you through some of the basics of this position. So for this position, mom needs to be leaned back comfortably. It's often kind of a 45-degree angle or approximately. So she gets herself comfortable, kind of leaned back like this. Okay, and then what she'll do is she'll get her baby, and the baby will be on the mom's tummy to tummy with the mom. And so this is one of the first very important things about any position. The infant needs to have kind of tummy to tummy contact with the mom, full contact. That helps babies feel stable. It's the way most mammals feed, and it's a really important element of any good position. The second important thing about this position is it gives the baby stability, because moms will naturally put their hands kind of on the baby's shoulders, on the baby's back, and that helps the baby feel stable, which is important. Okay, and so this position can be the baby. It doesn't really matter the orientation of the baby too much. Sometimes the baby will even be kind of beside the mother, kneeling on the bed or something like this. But the most important thing is that the infant is really prone on their stomach like this. Okay? Now often when baby's delivered, baby's put on mom's abdomen like this and will find his own way to the breast, or mothers will just be kind of cuddling their sleeping baby and their baby will wake up and just go find the breast on their own. That's part of laid back positioning or biological nurturing, but it doesn't have to happen naturally. Mothers can also facilitate it. If you get your baby on your chest like this, it's okay for mom to kind of, try to push her breast in the direction of the baby's mouth and kind of help the baby a little bit if she feels the baby needs it. Now, one thing that's important to know about this position is the baby will naturally try to use his hands a lot, which is actually really natural and helpful for the baby, because the baby can orient with the hands, and the baby will often get the hands on the nipple, suck on the hand, move the hand, and then latch. So for mothers whose nipples are not sore or tender, that's absolutely fine, and you can just let the baby enjoy and use his reflexes naturally. For mothers who have sore nipples, that may sound unpleasant, and so I think in that case it's okay to kind of, we wouldn't pin the baby's arms down or anything, but I think it's fine to kind of keep the baby's arms away from the breast and help guide him on. So just another couple of elements that are in place in this position are, when the baby latches on, the baby will reach up and latch on chin first like this. Okay, so there's a couple of good things about that. The baby going on chin first will help that tongue extend and cup the breast, which is important for latch. And there will also be some space, which I'll talk about later, between the baby's chin and the baby's chest, which is important because it means that the baby's in a good drinking position. And like I said, any orientation of this is absolutely fine. Mothers who've had a natural delivery may be happy with the baby's feet down this direction. Mothers who've had a cesarean may want to keep the baby's feet kind of away from their incision. So that is, those are the basics of biological nurturing. A couple other things to know about it are, one thing that can really facilitate it is having the baby in nothing but a diaper, and the mom with nothing on her top, so that they both are skin to skin. It's great for the mother's hormones and the baby's reflexes. And also, this position is great for babies who are, it's great for babies of any age, but if you're trying it for the first time with a baby older than 3 to 4 months, it may be kind of confusing for them because they're already in a very different developmental stage and will feel like it's a playing position or something like that. So this is particularly, I emphasize this for the very young babies. So in the next couple of videos, I'm going to be showing you how to apply these same principles of tummy to tummy, stability, baby in a drinking position, chin in the breast, and this good alignment that we had in the biological nurturing, how to apply that to other breastfeeding positions.